Good morning. Welcome to PPN 101 Radio. Today, our topic is the effects of privatization in healthcare. Many may argue whether or not privatization in the healthcare system is a favorable option. What do you think? Does it impact us negatively or positively? How can this be linked to Indigenous health? What are some nursing implications and interventions?
The issue we present is increased privatization of healthcare in Canada and its possible effects on healthcare, with a focus on Indigenous healthcare. This topic is important in relation to Canada's history and in the context of health, cites an important discussion on how history results in inadequate health and healthcare by healthcare professionals. Privatization also affects nurses and other healthcare professionals in that privatization proposes its potential to solve staffing shortages. And now handing it off to Ashani and Levi to discuss a news article concerning the issue.
Moving on, while reading Would More Privatization in Canada Healthcare Solve the Current Crisis by Adam Miller and Benjamin Shingler, Lavanya and I found some main points.
One of the main points is how the Canadian government is looking into privatization of healthcare to find solutions to healthcare problems. But there are many cons that are found, such as shortage of staff resulting in emergency departments being closed.
Another con is how Canada is known for their public health care, so once there's a division and more staffing goes towards private care, there'd be a lack of treatment for those who seek from the public system. This would be deemed as unfair.
Lastly, privatization isn't a simple solution as it can cause decrease of resources and an increase in inequality in some Canadians due to having low income.
That being said, there is also a pro. Privatization would take pressure off the public system as private clinics would be used to fill in gaps found in healthcare. For example, there's a shortage of family doctors, resulting in many not having access to primary care and they turn to the emergency room.
The government is saying they'll look into using private care solutions to fix public healthcare systems, but Colleen Flood, a research chair in health law and a professor at the University of Ottawa, goes on to explain how private clinics tend to focus on small procedures like knee or hip surgeries, when really most people will still need to rely on public systems for large treatments like things like cancer and heart disease.
In conclusion, there's many pros to privatization, but there's also many cons. It's better to look at the root problems and fix those first. Using a simple solution like private care can cause many Canadians to be left behind, and we wouldn't want that. Moving on, Trish and Wendy would be looking at the background of this issue using two peer-reviewed articles.
Is healthcare privatization the right solution? Lee, Rowe, and Mall conducted international research to determine the existence of a positive correlation between private healthcare systems and overall healthcare system performances. Now, before further discussing this, I would like to bring up the pros and cons. Advantages of private financing include improved access to healthcare and less pressure on the public healthcare system. However, many suggest that this would only help those able to afford the cost of privatized care, and that it could also impact the current funding for public healthcare, possibly making it worse. Throughout the research, the following aspects of healthcare systems were assessed in multiple countries: universality, equity, access, quality, health system performance, and health outcomes. The research concluded that more private services were not significantly associated with a better healthcare system. Private healthcare is only a temporary solution, and the same problems will arise once again. Even temporarily, the solution will be limited to certain groups of people, and many others will be left out, such as Indigenous people, which Wendy will further expand on.
The article I investigated, called Understanding Access to Healthcare Among Indigenous Peoples, provides background on the social determinants of health. The article states that access to care is limited up north where many Indigenous communities live. There's a lack of understanding of Indigenous healing practices and issues centering Indigenous health by healthcare providers, and socioeconomic factors that exist within populations: lack of clean water, fresh foods leading to high rates of diabetes, lower education associated with poor detection of early disease, and factors like domestic violence, substance use resulting from intergenerational trauma experienced by those who lived through residential schools, the 60 scoop, accompanied by a lack of understanding as how to enforce cultural competence and create an inclusive space without unconscious bias. So just imagine the effect it would have on Indigenous communities who already experience impaired access in the system we have with increased private healthcare. Next, Ashani and Trish will go over the philosophical approach to the issue.
To start off, this health concern is presented by a debate where two sides are arguing about the pros and cons of healthcare privatization, as well as the possible effects.
Well, Trish and I are going to be looking over the philosophical approaches. Now, we're looking at the article that was mentioned at the beginning. The journalist uses the critical social theory.
Exactly, and this theory goes over power imbalances and uncovers the unequal social, economic, and power relations between society and the healthcare system. But how did we come to this conclusion?
Well, when reading through the article, you can clearly see how the author wanted to shed light on how privatization can affect low income families. They did this by getting healthcare professional Colleen Flood to talk about inequality in low income families due to the difficulty of accessing healthcare.
Although the article does attempt to enhance the discussion, it does so very lightly and is still very lacking. This is also the case with the first peer-reviewed article, where low-income families are briefly mentioned but not further expanded on. In general, we lack their perspective on the privatization of healthcare.
Adding on, the main perspectives included in this article were those of healthcare providers, but the general population should also have an opinion. Other perspectives that could have been included are ethnic groups, cultural groups, different age groups such as the elderly, and especially the indigenous groups.
Right. As we mentioned earlier on in our presentation, Indigenous people already have difficulty accessing healthcare. Lately, we have already started to pay more in taxes, in basic needs, in mortgage interest rates, and etc. Privatized care would bring on even more financial burden, especially for the Indigenous people, who are known to face a higher rate of poverty.
Especially considering that they're also known to have health problems, for example, due to unclean drinking water, which results in more visits to private clinics. Thus, the cycle would just continue. Next, Wendy and Lavanya will be providing us more information on cultural considerations.
And culturally to provide efficient service. Through an Indigenous lens examining the social factors that impaired access to basic needs would help create a safe space in respect to their well-being. To enhance cultural safety, practicing the first approach is ideal. Having an on-site interpreter/translator is important as a person's English proficiency would allow for clear communication. Services with easy access should all be provided for those with disabilities. As healthcare evolves, having a psychologist on site is highly efficient within the system. They dive deep into the psychology of a patient and guide them with whatever they're struggling with. The Indigenous LGBTQ+ community has this ingrained stigma and discrimination that impacts an individual, so they should be culturally considered. Their gender, age, and physical image should not compensate for their healthcare. Indigenous voices are not being heard, especially with racism built into the structure, so it is best to be mindful of their beliefs and practices. With visible differences or low economic status, face negative perceptions, causing these services to be marginalized within privatization.
Private healthcare as a solution to stop the turnover of healthcare providers is what people argue. It does not address its potential to reduce the number of people seeking healthcare or cause people to be less inclined to address their health issues. For example, people who want preventative checks and screenings for illness and disorders. Healthcare can also become a burden to people with chronic illness or other medical conditions who rely on different services and have no choice but to pay. For example, without OHIP, a resident living in Ontario who needs dialysis done would likely pay thousands of dollars out of pocket. If they were Indigenous, how would the social determinants of health make access even more difficult? Cultural considerations in healthcare may not be addressed in that a lesser number of patients of various cultural standings would seek out care as a result of increased costs. And to end off the segment, Tia will discuss nursing implications of the issue.
There are barriers that affect Indigenous patients and patients suffering from privatization within the healthcare system, such as substandard quality of care, experiences of discrimination, availability to pay for non insured services. Some nursing interventions may include 1. Advocating for clients. Nurses can go through the necessary channels and speak on behalf of a client, or even advise clients on the best steps to take according to their situation. 2. Educating staff on therapeutic and trauma approach communication. 3. Addressing prejudice among healthcare workers. 4. Self-reflecting. Nurses may ask themselves simple questions and look within themselves. Am I treating a client a certain way because of where they are from? Or because they are not able to afford comprehensive healthcare? As nursing students, what are your thoughts about privatization within the healthcare system and Indigenous people? Please post your answers as well as any other questions you may have. Thank you for listening. Until next time, bye.